In this final video for Chapter 9, the nervous system, I am going to cover congenital neurologic abnormalities and diagnostic procedures in neurology. So let's start with congenital neurologic abnormalities. Remember, the term congenital means present at birth, so this list is going to contain abnormalities of the nervous system that babies can be born with. Before we begin, it is important to know that these abnormalities develop in the first 8 to 10 weeks of gestation or during development when the nervous system is being formed inside of the womb. That means that these abnormalities can be detected via ultrasound, and they can actually be prevented by supplementation of things like folic acid before conception and during early pregnancy. Now I need to warn you that there are some graphic images ahead, so just be wary of that. So the first of these congenital neurologic abnormalities we are going to look at is encephalo. This is one of the words on your word list, and if we break this word down into its parts, we know that the prefix "an" means without. The root encephaly means a condition of the brain. So if we put those together, encephalo means a baby is born with an absence of the cerebral hemispheres, meaning they're born without most of their brain. This is always fatal. Like if you remember that cerebral hemispheres are the largest part of the brain, we literally can't function without that. So this is always fatal in newborns. This usually happens between the 23rd and 26th day of conception due to the neural tube not closing off during development. And about 75% of babies with this abnormality are stillborns. So they are born not alive. The next congenital neurologic abnormality we are going to discuss is called microcephaly. This is also one of your words, and if we break this word down, the prefix micro means small, and the root cephaly means a condition of the head. So if you put these together, this is a condition with which an individual is born with an abnormally small head. The small head size is due to small cerebral hemispheres, and so due to this, individuals born with microcephaly usually have moderate to severe motor impairments, so movement issues, and they also have moderate to severe mental retardation. So anencephaly is where you don't have cerebral hemispheres, and microcephaly is where you have small cerebral hemispheres. The next congenital neurologic abnormality is called hydrocephalus, and this is also one of your words. And if we break this word down just like the others, the root hydro means water, the root cephal means head, and the root that's a suffix, us, means pertaining to. So again, if we put these words together, we can understand that hydrocephalus has something to do with the head and water. It's a little more complex than that. So hydrocephalus is an enlarged head, as you see in the picture, due to excess CSF in the brain. CSF is one of your abbreviations, and it stands for cerebrospinal fluid. This is the fluid that surrounds your brain and your spinal cord to help protect it, to help cushion it, and also to provide it nutrition. So you have a buildup of fluid in that brain which causes an expansion, and this is due to some sort of obstruction that prevents any cerebrospinal fluid in the brain to not be able to exit it to go back into the spinal cord and recirculate. So the treatment for this, it is treatable, is to surgically get a shunt put into the brain to allow the excess cerebrospinal fluid to drain out of it. So surgery is needed for this condition. The last congenital neurologic abnormality we are going to discuss is fetal alcohol syndrome, also known as FAS, and that is also one of your abbreviations. So this syndrome, as you can probably guess from the name, is caused by alcohol exposure of a fetus during development, obviously due to a mother consuming alcohol while she's pregnant. Babies born with this syndrome often have a smaller than normal head. Usually they have pretty narrow eyes and a flat face and nose. They are also born with impaired intellect and growth. Fetal alcohol syndrome is a major cause of mental retardation because the alcohol exposure during development causes brain damage, and that is absolutely irreversible. Now let's take a look at some diagnostic procedures that neurologists use to diagnose patients with any of the conditions that we've talked about so far in this chapter. There are quite a few of them, but I'm only going to cover 4 of them for time's sake. And the first one is electroencephalography. This is a word on your word list, and if we work on breaking this big word down into its parts, we know that the first root, electro, means electricity. Encephalo is the second root, so there's 2 roots in this word, and that means brain. And then the suffix graphy means the process of recording. So the term electroencephalography refers to the process of recording the brain's electrical activity. This procedure involves hooking up electrodes around the skull, as you can see in this picture here, in order to diagnose usually things like seizure disorders, sleep disturbances, degenerative brain disorders like Alzheimer's, and also just general brain damage. Now let's sidetrack a few minutes and take a look at some very similar words to electroencephalography, all of which are actually on your word list, including one abbreviation. So we've talked about electroencephalography, which is the process of recording the brain's electrical activity. So this would mean as the individual is attached with electrodes around their skull, and as they are actually collecting and recording the brain's electrical activity, that would be electroencephalography just in general. Now the suffix graph, as you can see in the next term, refers to an instrument used to record. So an electroencephalograph is a device used to record the brain's electrical activity. Okay, so this is referring to the electrodes that are attached to the person's head, and then the machine that those electrodes are connected to that actually does the recording. And finally, the suffix gram, as you can see in the third word on this slide, refers to an actual recording. So an electroencephalogram is going to, also known as the abbreviation EEG, which is one that you need to know. That is the actual recording of the brain's electrical activity that the doctor would then study to make a diagnosis. So you can see on the slide that bottom picture with the green waves, that would be an electroencephalogram. So altogether, the electroencephalograph, which is the device, and the electroencephalogram, which is the record produced by the device, those together are going to collectively be part of electroencephalography. And if that didn't make sense, try listening to this slide over again, because these are 3 words that you will need to know with very slight differences in the words themselves and their meaning. So this could be a challenging portion of this chapter. The next diagnostic procedure that we're going to talk about is computer tomography, which is abbreviated CT, which is one of your abbreviations. You might have heard of something called a CAT scan, which is very similar to a CT scan, but it's just older. So a CT scan is basically a CAT scan, but the newer, more advanced version of it. So you've probably heard of a CT scan before if you haven't maybe already had one yourself, but it's really just this donut-shaped machine that produces x-rays of like slices of your brain. So basically this procedure uses a really narrow x-ray beam that circles around your head and creates images from different angles, which the computer then uses to create like these cross-sectional images like the one you see on this slide, kind of like a slice of bread. So it does not only have to be your brain that goes through a CT scan, it can also be other parts of your body, but it really produces, it takes whatever body part you are getting scanned and it creates those cross-sectional images like a sliced loaf of bread. During this procedure, you have to be as still as possible for anywhere from a few minutes to about a half hour. If you move, it blurs the image and then the text would have to start that all over. And this procedure in the field of neurology is used to detect things like tumors, any sort of areas of dead brain tissue due to strokes or due to other neurodegenerative diseases like Alzheimer's, and also it can detect birth defects as well. Another procedure is an MRI, which is also one of your abbreviations, and you've probably heard of these before. This is what I got on my ankle prior to surgery. MRI stands for magnetic resonance imaging, and these are going to produce very detailed images of the body part in question. So you can see the image on the slide shows an MRI of an individual's brain, and as you can see, it is very highly detailed. In neurology, this diagnostic procedure is going to be used to determine if an individual is basically any neurological disorder. Because the images are so detailed, it can basically diagnose anything, but it's especially used after someone has suffered a stroke to see how bad the stroke is, if there's any brain tumors, or also it can detect any myelin sheath damage as well. The last diagnostic procedure I'm going to discuss in this video is echoencephalography. And if we break this word down as well to help us understand it, the root echo means sound waves. So if you think of an echo, you are basically bouncing your sound waves off of different surfaces. The root encephalo means brain, and the suffix graphy means the process of recording. So if we put those together, echoencephalography is going to be the process of using ultrasound to create images of the brain. And this is not harmful, but it can only be used in children under 2 years old because their skull is thin enough for sound waves to get through to the brain. Adults have too thick of a skull to get sound waves through, so we can't use it past 2 years old. Again, there's no harm in this procedure. It's often used to diagnose any abnormalities in the brain, any hemorrhaging that might be happening, or brain tumors in infants. If you want to read more about these diagnostic procedures, because again, I only covered 4 of them, there's a bunch more on page 314 in your textbook. I'm only going to test you on these 4, and that's the end of the Chapter 9 video lectures.